you don't know this, but I just spent 10 minutes making this video. Now I gotta redo it. But anyways, welcome back to your doctor appointment. And today we're gonna be doing a yearly checkup. We're gonna go with the 5 senses: the mouth, the nose, the ears, eyes. Okay, we're gonna get all of them, and we're also going to check your pulse points, pressure points. Let's see, I'm also going to ask just some questions, just general things, and we're gonna see how everything goes. So if you don't mind, can I ask you for those few questions? Perfect. I'm going to take the notebook. Okay. And I'm just going to find a page. Oh, everything's gonna drop in. These are the papers I'm gonna need you to sign later, okay? They shouldn't take too long. They might take some time. Okay, find the pen. Oh goodness, things are dropping. So, just need you to focus for a few seconds and then things will get more relaxing, okay? So, can I have your name? Date of birth? Okay. Any medication that you're on? I have no idea what that was. That's on. Oh my god. Okay, sorry. And do you have any diagnoses from any other doctors? Okay. And is there anything that you need to be checked upon? Any concerns, health concerns? Okay, perfect. Or, yeah. The yearly cold is going around. Did you get your flu shots, COVID shots? Sorry, did you get those shots? It's okay if not, the clinic is always open if you want to stop by, get them. But again, we don't enforce, or we do enforce, but we don't force you to get those shots in case you don't want vaccines. It's totally fine. We do recommend them if you do have like an elderly person or a baby around you constantly, because we don't want them to get sick. Okay, perfect. So I have no idea why I just stuck my chicken. It was kind of weird. So again, I have these wellness forms for you to fill out. Sorry if I had a pocket on the front and back, because I didn't. There are 3 different forms. We have one for, again, wellness, so depression, if you need help, just one about you, essentially just things like your current address, pharmacy, etc. And these are all pretty simple. You just gotta get them done by the time you leave. Okay, perfect. So I'll leave those there for you, and we're gonna get started. So as you know, we are an office, and we use improv stuff where things to replace stuff. So we have these new technologies. We have these new equipment that came in. So this is going to take your blood pressure. So we're gonna see if everything's okay, and it might hurt just a little bit, but I promise it'll be quick. Okay, so I'm just gonna come around on you. Oh, come around on you. By that I mean I'm gonna come up to you. Okay. So that's gonna take about 10 10 seconds. So it's almost done. I swear it's almost done. Okay, there we go. Ooh, careful. Got a little stuck on you. So your blood pressure is perfect. Good job. If you do ever have concerns about your blood pressure or any health concerns, again, you can always come back to us, okay? So let's continue. The next things that I'm going to be doing involve some sanitizing. I'm just going to check your skin, your esophagus, your pressure points, your pulse points especially. So I'm going to be using some sanitizer because I do also need to feel the texture of your skin and the warmth. So I'm just going to use this. Okay. Yeah, it smells good, doesn't it? It smells really good. So let's continue. Sorry, I just gotta readjust my seat. So I'm just gonna come over and I'm gonna feel your pulse. Okay. So I'm just gonna go here. Okay, that one's a lot normal, but hopefully this one will be a little bit better. So just hold your breath for 5 seconds, okay? 1, 2, 3, 4, 5. Okay, that sounded great. Okay, so I'm just gonna come in now. I'm just gonna feel your esophagus. Okay, so I'm just gonna gently. Can you swallow? Okay, perfect. And then, can I see your wrist? Okay, I'm only gonna do one. Okay, that sounded great. So I'm also gonna get your knees, the pressure points down here. Okay, so just hold still. Okay, perfect. And then hold still. Perfect. Okay, so let's continue. We're now going to get to the 5 senses: mouth, nose, eyes, the ears. The mouth is a little bit of the easiest. Same with the nose. So we're gonna start with those first. Okay. So gotta look around for my things. Very good. I have this light. It's actually pretty bright, I'm not gonna lie to you. Then I also have this tool. It's very dull. And I know there's a difference between dentist and like wellness doctor, but I'm going to be looking at the back of your throat, especially since it is cold season and I want to check out your tonsils, just see if they're inflamed, and if they are, then we can tell if you're sick and whatnot. If you don't have tonsils, that's okay. I'm still gonna look back there. I'll be able to tell if you have tonsils or not, so don't even worry about telling me, okay? So I'm just gonna gently open wide. I'm just gonna gently come in. Okay, I'm just gonna gently. Do you feel that? Okay, can you stick out your tongue? Okay, I think there's a little bit of a buildup of bacteria. Do you get tonsil stones easily? No? Okay, that's good. Sometimes I do hide back there. There's like this little hole in your tonsils or skin that comes. If you kind of stick in there and pull it back, you can see like a whole little area. So I would recommend to contact your dentist or anyone really to get that checked out. You can always do it yourself, but we don't recommend it. It can sometimes end up with you damaging the gums. In your throat, there's a lot of nerves that are important, and you'll start bleeding a lot, so you gotta be really careful, okay? So everything looks good in there. We're going to move on to the nose. I have some simple stuff. Have you gotten, can I feel it? Have you gotten surgery of any sorts on your nose? Okay, the cartilage looks really intact, which is good. Have you gotten piercings? Okay. Yeah. Okay. So it all looks intact. If you do get another or just a piercing on your nose in the future, just be careful about where you get it, because we don't want to mess this up. So can you tilt your head back so I can just look in? I'm just gonna gently pull at your nostril a little bit, just so I can see it down. Just so I can see. Okay, good. Can you tell me what this smells like? Okay, good. Is your nose clogged or anything? No? Okay. What does it smell like? I don't know if you saw, but it smells like oranges. Okay. Good job. I think everything is looking good. I'm just gonna let me boop boop. Okay. So next up, we're going to quickly just inspect the hearing. I have the same tools, these, and I'm just going to quickly clean this since I used it in your mouth. Just use this little tool. Okay. And just wrap it around. It's all clean. So can you turn your ear just to the side? Yeah, this one again, this side. Okay. You can use this bright light again. I'm just gonna come over here. I'm just gonna come over to this ear. I'm just gonna see it. The ear looks fine. The canal doesn't seem damaged or anything. The cartilage looks good. Do you have piercings? Okay. The cartilage seems intact. Everything seems good. And then I'm just going to gently put this in a little bit deeper. Okay. First, I'm just gonna feel it for a second. I'm just gonna feel it. Okay. I'm gonna gently go a little bit deeper into the ear. Okay. There's a little bit built up, so I'm just gonna gently. Okay. Does everything feel okay? Yeah? Okay, perfect. Have you had any ear issues from the past? Hearing? Okay, so if I go over here and I say kitten, did you hear what I said? Kitten? Okay, perfect. That's good. Let me just. The cartilage is something that we often worry about. A lot of people, especially if, I don't know if you're into it, but if you're into stretching out the skin, we have a lot of issues with damaging the cartilage, but also the fat in the ear. Yeah. But this all looks good. If I just gently, do you feel that? Okay, that's good. So we're gonna turn you. Just a bit careful. I want you falling over. Okay. We're gonna get this eye section too. Just gonna come with the light first. Gonna just look down the tunnel. Okay. Looks good so far. Gonna get. You have a little bit built up again, so I'm just gonna gently. Let me get in here a little bit more. Feel free to close your eyes if it's a little too bright. Okay. Yeah. Build-up seems fine. Let me just squeeze this area. Check in on the cartilage. Have you ever had surgery on this ear? Surgery. Yeah. It's looking a little bit different compared to this one, but that may just be an enormity that happened when you were born. If you're not bothered by it, and I'm not bothered by it, it doesn't seem concerning enough to say anything, but okay. Okay, you can turn back over. Okay, perfect job. Perfect. Okay, so I don't see anything too worrisome about your ears. Oh, we didn't do a hearing test. Okay, puppy. Did you hear? Puppy? Yeah, that's good. If you ever had trouble with hearing, then I'd recommend going to what's it? Nose, mouth, and ears. NME, EMN. I don't know. One of those doctors again. At an ear doctor, they'll perform more tests, and in some cases, you might have to get hearing aids if the hearing starts to get progressively worse. But I don't see any concerns, and for the nose, I also don't see concerns. A lot of times when you get sick or maybe you hit your nose wrong, things can get closed off a little bit. Yeah. Have you had bloody noses before? Okay. So a lot of times if again you hit that nose, there can be a cut on the inside that just continuously bleeds, and that is a recurring problem. Sometimes you might have to get a different doctor to check it out to see how big the cut is and if it'll heal on its own or if you need to help it, which is a simple procedure. But besides that, I think it's all good. Okay, so let's get to the eyes. Yep, the last part, we're getting close to the end. And again, simple tools. Honestly, I'm just gonna use this. So can you close one of your eyes? Just stick it up. Okay, perfect. And I'm gonna kind of with this light on this side. Okay. Can you? Okay, I'm just gonna look over here. You can open your eyes now if you'd like. Do you need? Here, I can turn the light off actually. Maybe I can't. Okay. So it's gonna be super bright. So I'm just gonna come and I'm just gonna go right over. Can you close your eyes for me? Close your eyes, yeah. I'm just gonna gently go over the top of your eyes to see the skin. A lot of the times the eyes will glow a little bit and I can see the veins. Okay, you can open your eyes. And can you look up? I'm just gonna look at the bottom, keep looking up. Okay, that looks good. Can you look down? Okay, this looks good as well. Okay, can you look here? Okay, this side looks pretty good. And then lastly, just look here. Okay, can you look at my nose? Just keep looking at my nose. Okay. Can you follow my finger? I'll put a little spotlight on it. Can you follow my finger? Okay. How many fingers am I holding up? 4. How about now? 5. How about now? 1. How about now? 2. Can you look at my nose? We're gonna do the same thing. Okay, look at my nose. How many fingers? 4, 2, 5, 2. Perfect. Is there any concerns with your eyes? The dilation looks great. See how mine is? Pupils dilations. When was the last time you went to an eye doctor? Okay, perfect. Can you follow the light? Close your eyes if it gets too bright. I won't mind. Okay, perfect. Let's turn this light on. And we're gonna turn this one back on. Hi. Okay, everything is looking great. and your appointment is officially up. But before you go, I want you to squeeze my hands. Okay? And can you blow on my hand? Perfect. Do you have any other worries? Acne, or if you have any worries, you can always contact us. We can always recommend you to a certain doctor in case you don't specialize in that, which is totally okay. Not everyone's built awesome. But besides that, you're free to go. Don't forget to fill out the paperwork. You have 20. No, you have a month to complete it, but it could be a little bit long and boring. It's about 4 pages, not double-sided, so it's literally just 4 pages. You can sit in here and finish it if you want, but if not, you're free to go. We have the pink section, red and white, green. What color is this? Purple. Good. Purple or pink. What color is this? Blue. And our final test to see if you can leave. What color is this? Green. Awesome. Okay. Goodbye. Sweet dreams.